Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I am excited to welcome board-certified endocrinologist Dr. Angela Mazza, a clinician committed to an individualized approach in medicine with a focus on patient education, lifestyle management, and a positive therapeutic relationship. Thank you so much for joining us today, Dr. Mazza.
It's a pleasure to be here.
Can you share a little bit about your background and training?
I went to Nova Southeastern College of Osteopathic Medicine. I did internship and residency in categorical internal medicine and did fellowship in endocrinology, diabetes, and metabolism. So I'm an endocrinologist.
And why were you interested in endocrinology?
Endocrinology was always a field I was really interested in, even going into medical school, because diabetes runs in my family. So that was kind of the main reason from an early age. That was something I was interested in.
Where do you practice?
My practice is the Metabolic Center for Wellness, and we're located in Oviedo, Florida, outside of Orlando.
How long have you been there?
This July will be our 3-year anniversary.
And as a specialist in endocrinology, how do you initially integrate a holistic approach with your patients?
Well, I feel like the field of endocrinology is integrative in and of itself because hormones interact with each other and they're so influenced by everyday things as well as lifestyle, things we're exposed to on a regular basis. So it in and of itself is integrative, I believe, although not all endocrinologists treat it that way.
Are there specific protocols and practices that you implement?
Well, I approach every patient as unique, so I try to take a personalized approach to each patient. There are certain protocols I kind of go to and work off of as far as folks with insulin resistance versus folks with autoimmune thyroid disease versus other hormonal abnormalities.
When were you initially introduced to A4M?
I was introduced to A4M about 5 years ago. I was in a traditional endocrinology practice for about 5 years outside when I finished fellowship and found that my patients weren't getting any better. I was becoming more frustrated, and through kind of a series of really good events was introduced to A4M, and from that point on it's been great.
How did it change the way you practice medicine?
Well, for one, I didn't stick with kind of the standard guidelines as far as traditional endocrinologists follow, because some of them don't always take into account the whole person. As far as diabetes management, the current guidelines, according to the ADA, don't really address lifestyle management and weight loss. And then from then on, I had more and more patients coming in asking about other alternatives rather than just medicine and traditional pharmacologic agents, and kind of went forth from there.
So you are about to finish your fellowship training?
I'm completing my fellowship now.
And how has that experience been for you?
It was great. I mean, it's a lot of work, but I learned a lot of things that I wouldn't necessarily learn, I don't think, outside of the regular endocrinology scope. So it was a great experience.
Can you explain how your approach to medicine, specifically your commitment to treating root cause, as opposed to solely focusing on symptoms, differs from any traditional medical training you may have received?
Well, for example, that's a tough question because, again, every patient's a little bit different, and I kind of get patients at a different point in their journey than a pure functional doctor would. I tend to get referrals in the more complicated patients who have failed other therapies, so it can be challenging. For example, as far as thyroid goes, autoimmune thyroid disease, really getting at the root cause rather than just treating patients with thyroid hormone medication is, I would have to say, on a regular basis is kind of one of the things I see in my practice every single day. Because it's not just giving patients a prescription, it's really addressing lifestyle, addressing stress management, addressing nutrition, as well as using nutraceutical agents when you can.
And are your patients open to that approach?
Some of them, yes. Others not, and then we kind of try and work with what they are willing to do.
So, how did you initially become interested in this individualized or personalized approach, which focuses on patient education and lifestyle management and a positive therapeutic relationship?
Well, I can't say that there was any one point in time. It's something that I kind of always believed from the start. Take, for example, diabetes management. Um, Diabetes is affected by so many things, and every single person has a different work schedule, sleep schedule, responsibilities, stressors, financial restraints. So, and I think just over time, perhaps when I came out of fellowship, I expected everybody to be able to do A, B, C, D, E, F, and G. Well, everybody's a little bit different. So over time, I figured out, okay, what are good strategies for folks that work overnight shifts? What are good strategies for folks that have a lot of family stressors? So it kind of worked off of that.
So, what are some of the primary challenges that you see healthcare facing today?
There's so many. um, Definitely, insurance is a big issue. One of the challenges, my clinic accepts insurance. We have kind of a hybrid model where we have a yearly fee, but we still do process insurance, and I tend to integrate traditional pharmaceutical agents with more functional medicine, but even basic medicines, we spend countless hours getting prior authorizations for because insurance companies don't want to pay for them. And it's just that I think the people that are making decisions about this don't understand how it's actually just hurting their clients who pay their insurance premiums. I'd say that's one of the biggest things that we see on a day-to-day basis. I think education's a real challenge as well. Patients having access to education, just a good dietary habits, good sleep hygiene. I think that's one of the challenges. We live in a society that never shuts down. So we have people that have stressors of all sorts of kinds, whether it's work stressors, money stressors, never shutting down. It's a challenge compared to like even 15, 20 years ago. So those are challenges that we can't fix, but there are local factors that we can address, and that's what I try to do on a day-to-day basis. All right, maybe things aren't perfect at home, but let's kind of try and come up with ways that we can meal plan a little bit.
And what do you hope the future of medicine looks like, say, 5 years down the road?
I hope the future of medicine moves more towards a personalized approach, because right now what we're dealing with on the global scale is really a cookie cutter approach that just doesn't work for everyone.
And why do you think it's so slow to turn to make that shift?
Well, I think as physicians, we have to take some of the blame because I think change is hard and change is not always easy and uncomfortable. So I think as physicians, we have to take our part. I think we need support from government as well. Insurance has to step up too, so we need to move forward together.
And it seems like patient education will help to turn that tide.
Yes. And at least giving patients the tools to make some changes.
Is it challenging to you when patients search the internet and get all sorts of information or misinformation about diets and protocols and even diagnosing themselves with various conditions?
Well, I always welcome a proactive patient, so I kind of look at it as that way. They're looking for something that may help them. So I always say, well, okay, maybe this isn't backed by science or data or anything, but let's talk about things that, maybe somewhere along that scope that might work for you that is validated. So I never discourage research, but we have to be careful where we get our data from, or not really data, but Dr. Google doesn't really know everything.
Aren't thyroid issues a problem and oftentimes misdiagnosed or not properly diagnosed or not even properly addressed?
Yes. When we use the general, even just laboratory ranges, oftentimes underlying thyroid issues are missed on a regular basis. So it's important that we do a full evaluation of the thyroid to say yes or no that the thyroid is the cause of any symptoms. Oftentimes when people come to me, they've already had some sort of abnormality. But I would say that that's where oftentimes patients push for more lab testing, and that's where it gets found. So that's where the proactive patient comes into play.
And the types of testing that A4M and MMI physicians do is a little different than the traditional testing.
It digs in a little bit deeper than the standard TSH. So TSH is just kind of a basic screening test, and it just misses a whole lot. So the A4M, MMI really has a more complete panel that's recommended.
Can you share a couple of success stories? Maybe a patient or two that came to you with an issue that they've not been able to resolve and you took an approach that got them well again?
Actually, I had a patient who was treated for hypothyroidism for a very long time and was placed on standard levothyroxine. And this isn't just one patient in general. I have a lot of patients like this. But we really did an in-depth evaluation of their micronutrient status. It turns out they were severely deficient in a lot of micronutrients, and their gut was really off. When we fixed what was going on with their intestinal permeability issues, replaced their micronutrients, we actually were able to take them off thyroid medication because that was the sole underlying cause of their thyroid disorder.
So in addition to being a clinician, I understand that you also serve as a teacher, professor, researcher, and investigator. Which role do you feel brings you the greatest satisfaction or that you find most rewarding?
Well, I think that they all give me satisfaction in one way or another. I think just being a doctor, that is inherent in being a teacher. So I'd have to say that's probably the most rewarding. So teaching other physicians, teaching my patients, teaching students, so that really is the definition of doctor to me.
And I'm sure being here at an A4M conference, surrounded by like-minded physicians who are also traditionally trained, is quite unique and validating,
right,
as you have practitioners from all specialties and disciplines coming together to further educate themselves about integrative, anti-aging, functional medicine. I would imagine it's very gratifying.
Oh, this is a very unique opportunity. So unfortunately in medicine, in traditional medicine, we oftentimes silo different factions. So like you said, cardiologists, endocrinologists, gastroenterologists. But to see everybody interact is really, it's rewarding.
We certainly do need specialists, but it's good to see that these specialists are looking to broaden their knowledge and field of vision and toolbox, so to speak.
Yeah, because I mean, you really aren't helping anyone if you're just focusing on one thing. Just like hormones, no hormone lives in a vacuum. It's influenced by other hormones, and that affects the cardiovascular system, that affects the gut, that affects the brain. So it's so integrated, it just makes sense.
So prior to coming to A4M 5 or 6 years ago, were you already utilizing bioidentical hormones in your practice?
I was not. So I worked in a practice, it was a hospital-based practice, where none of my partners wanted to address any sort of hormones outside of traditional, like we didn't even address female hormones, to tell you the truth, which was kind of sad. I mean, I had female patients coming to me, and because my partners didn't want to do it, the administration shunned it, so.
So when you switched to bioidenticals, what kind of differences did you notice with your patients who may have been using the traditional protocol?
Well, I think one of the main differences is women oftentimes come to me for their thyroid, but there's other issues going on, and a lot of times it's menopausal related symptoms, perimenopausal related symptoms, and it's tough to tell the two of them apart. So that's why I think it's helpful to address the whole person, because otherwise I'm stuck just working on a thyroid that's never going to fix, when it's actually it's more menopausal, perimenopausal related. So that's where it's a lot more rewarding. I get better outcomes, patients are happier,
Do you find that you're seeing more and more autoimmune related issues and Hashimoto's today?
Definitely. 100% definitely. Now part of it I think is an increase in autoimmune disease. I think part of it is we're looking for it a little bit more closely, but without a doubt, yeah.
Are there environmental factors? What do you think accounts for the increase other than now you're looking for it and actually testing for it?
Right. Well, there's a few things. So obviously there's a genetic component to autoimmune disease. And then there's things that we're exposed to, whether it's environmental toxins, whether it's stress, whether it's poor diet, and then in turn, our gut plays a huge part in autoimmune thyroid disease because something has to turn the genes on, and we're exposed to so much more. We have so much more gut issues than before, poor eating habits, and that's where you really have to address the gut as well as other influencing factors in order to fix Hashimoto thyroiditis.
Are antibiotics responsible for a lot of the gut issues you see?
They are. I mean, antibiotics have a role in healthcare, but they also play a number on our gut. So the more and more antibiotics are prescribed for perhaps not necessary reasons, it does destroy the microbiota of the gut, and that needs to be replaced because that in turn is going to affect the permeability of the gut. The immune system gets triggered, and then that kind of keeps that train rolling with the autoimmune thyroid disease.
So any pearls of wisdom for the practitioner watching and listening who might be interested in transitioning to an integrative and metabolic approach?
If you're thinking it already, then you probably should expand upon it a little bit more. So go to a conference, sit in on a few lectures, sit on a couple of the webinars on the website. Just pick a couple topics and start with them. Because if you're already thinking that, you're probably in that mindset where you want to learn more.
And the more you learn, the more you want to learn.
Yeah. It's like you don't know what's out there until you start looking, and you're only helping yourself, you're helping your patients, and the outcomes are good.
Is that how it was for you?
Definitely. Yeah. And my patients really appreciate it.
So for the layperson who was watching and listening, what would be your one piece of advice in regard to diet and supplements and lifestyle choices?
What I usually tell my patients is it's good to have huge goals, say even weight loss, but pick something realistic and just pick one thing and work on that first. So even if it's just, hey, I'm going to go for that 10 to 15 minute walk on a daily basis, start with that, get that down. Then I'm going to start meal planning. So plan on Sunday for your work week. Just pick small things, because what I find is people shoot for the stars and they get frustrated, and then they kind of fall off, especially when it comes to diabetes management. From a thyroid standpoint, it's important to just, if you're not feeling well, talk to your doctor. If there's something wrong. I mean, not everybody feels great every day, but if you're not feeling well, then you have to voice how you're feeling to your physician.
Let's briefly touch on type 2 diabetes and the epidemic that it is. What do you think are the primary causes for our increase in type 2 diabetes?
I think there's a number of causes. I think one, from a financial standpoint, people have a fixed income, and unfortunately, food that's processed and is cheapest, and sometimes that's a limiting factor. I think lack of education is part of it. Not knowing what's good food and what's bad food. I think lack of sleep is a huge thing. We live in a 24-hour society where nobody shuts down. The last thing we do when we go to bed is check our email and wake up, and it's not a restful sleep. Stress management, people are overwhelmed, they don't know how to deal with it, and then it only makes matters worse. So, and then there's genetic factors, obviously, but we can't control them as much. But I think food, education, sleep, and stress, those are the key factors.
Well, you've been great. Thank you so much, Dr. Mazza, for spending some time with us today.
Well, thank you for having me.